Hello, everyone. My name is Manuel Castañeda, Director of Community Health here at New Brunswick Tomorrow. And I want to welcome you to the health section of our Black History Month series. And being that we're covering health, we're going to be covering health and how certain things, certain health disparities, certain health issues are particular to the Black and African American communities and the importance of recognizing this. And we have a great doctor, Dr. Tiffany Toliver with us, and we're just going to have a conversation on these issues. And so thank you so much, Dr. Toliver, for agreeing to do this. We really do appreciate it. I know the community appreciates these conversations. And so maybe if we can just start with maybe just, letting the community know a little bit about yourself.
Hi, thank you for having me. I'm very excited to be here and to do this. My name is Tiffany Toliver. I'm a family physician here in New Jersey. I'm practicing in Union, New Jersey, and I serve as a primary care provider, or PCP, as we like to refer to it. I'm from New Jersey originally, and I've did my training in the Caribbean, partly in New York, New Jersey area. I did my residency training in Maryland, came back to New Jersey, and here I am.
Yeah, we have similar stories. I can't get out of New Jersey either. So, I've accepted that this is where we need to be.
That's right.
So, again, thank you. So let's get into this, right? So what are some of the health disparities affecting the Black and African American communities in particular?
Right. Well, so in the African American community, the mortality rates or the risk of dying from any particular disease or illness is much higher than compared to other groups in general, even though the CDC has shown the death rate has gone down by about 25% over the last 17 years. This group is still very much at risk of dying. And we're seeing younger age groups that are being affected with chronic disease, such as diabetes, which was especially type 2 diabetes, which was classically an adult onset diabetes. We're seeing in children now, and we're seeing more in the African American community. And in general, there's higher risk of chronic diseases, especially heart disease, stroke, diabetes, cancer, HIV/AIDS, even pneumonia, and complications from influenza are a lot higher as well. And the CDC has also said we're about 2 times more likely to die from heart disease and as younger adults from about 18 to 49, and about 50% more likely to have high blood pressure than compared to Caucasian population and around age 35 and just under 65. And then maternal health is another big issue, about 3 times more likely to die from pregnancy-related causes. It's so overall, it seems that the main issue is access to care. It seems that we're really having a hard time getting African Americans into care. There's many possibilities for that. One is just lack of insurance. People say, I can't afford it. I have to pay my bills. I have to put food on the table. How am I going to take care of myself, even though it's very important, And another issue that's very big and important is kidney failure. We have a lot of people on dialysis. About 1/3 of African Americans or dialysis patients are African American. When you look at the whole perspective, we make about 12.7% of the population, and about 1/3 are dialysis patients are African American, and that usually happens from uncontrolled hypertension and diabetes. So, we really have to find ways to, improve care and improve access, and just there's a lot of work to be done overall.
No, you brought up a lot of good points, and let's kind of drill down a bit here. So you mentioned, that one of the major issues is chronic diseases, right? And I guess it's scary to hear that the mortality rates are actually getting larger, right? In the sense that it's affecting the younger demographic, that actually, our younger Black and African American people are dying much sooner than I would say, if I heard you correctly, the national average for those particular illnesses. Yes. And so that means the onset is happening earlier, right? And so when we talk about, I understand access to care being one of the major issues, and yes, obviously wanting to work with the health systems that we have here available in order for people to get the care that they need when they can seek it, right? Because I think a lot of the issue with access is People are working 2, 3 jobs at this point, and
Right.
can't go to a doctor's appointment because that means that they won't be putting food on the table for that week,
Right.
and so I think it's understanding, how socioeconomic status or what you need to do in order to live, especially in New Brunswick, when we know that, over 70% of their income is going just to housing alone.
Right.
Meaning
Well,
that's rent, right? So you're 70%, at least 70% of what they're making is going straight to rent. That means everything else, the 30% has to cover pretty much everything else,
right.
and it's not sustainable, right? And so I know people, that are working 2, 3 jobs, working, a day and a night shift, in order to make ends meet, right? And then obviously without time and without, I think another resource that becomes a problem in terms of people, maintaining access to care or getting that access to care.
Yes.
But let's talk about a bit, of the diseases that you brought up, because I'd like to kind of dig in a bit deeper. So you mentioned diabetes, and I know diabetes is big in minority communities, especially the Black and African American communities. But
Yes.
why is that? Why do you think that is? I mean, I know that there's different things. So we did talk about access to care, but what else, I guess both physiologically and then we can talk about social determinants of health that is
Right.
causing this particular chronic disease to be a major issue.
Right. Well, diabetes, I mean, one reason we're seeing it in younger populations is because obesity is also a big issue. And there's a very clear link with obesity and especially type 2 diabetes. So just to back a little bit, type 1 diabetes is onset, you're born with a deficiency of insulin, need insulin lifelong. So that's a different type of diabetes. So the type 2 diabetes is what we call it, or we used to call it adult onset. I guess we can call it acquired. Just the insulin that you have is just not working as well as it should. And obesity is a very big issue. So we're seeing a lot, especially in younger, especially in kids and younger populations. Not one issue is not having access to the right healthy foods, or not having time. Again, people are working a lot, don't have time to prepare healthy meals all the time or home cooked meals. So that is one factor. Also, there is a bit of a genetic component to type 2 diabetes as well. So if you have parents that have type 2 diabetes, you are more likely to probably get it, but there's things you can do to help. So working on following low carbohydrate diet and exercising helps. Then that is easier said than done. It's fairly simple concept, but it's just so many factors that inhibit people being able to do those things.
Yeah, no, absolutely. And I think, when we talk about the social disparity, the social and health disparities that affect that, right? You mentioned access to foods, right? Number one is making sure that there are supermarkets or grocery stores that can provide that fresh produce, right? So that you can eat healthy. But I know even for myself, eating healthy is expensive.
Yes.
Right. If just looking at it in its basic, economics, right? Where I can go get a full meal at McDonald's for less than $6. You're lucky if you get 2 carrots for $6.
Right.
Sometimes it's not even a matter of, oh, I don't want to eat good. It's I can't eat good because I can't afford to eat good.
Right.
So I hear you that, and I guess it does make sense at that point that if this is happening to the younger generations, whether it be because of lack of income, of just access to good foods, time, we mentioned time, then what you're going to be eating is the stuff that you shouldn't be eating, which is going to cause, to your point, quicker obesity, and then obviously the onset of these diseases. So how about you mentioned heart disease, high blood pressure. How does that factor in?
Right. So one of the big factors, again, is genetics. There is some genetic component to it, but also low sodium is very important for blood pressure and heart health. And again, a lot of the foods that are available readily have a lot of salt. So that is another issue. There have been reports Mediterranean diet is very effective in preventing heart disease, but again, that is, there's a cost issue with that. There are, mostly grains and lean meats and fatty fish like salmon. These things are not cheap, and sometimes not affordable. Actually, for a lot of people, not affordable. So that's one issue. And then also heart disease is important to do some type of physical activity. That is very important to keep the blood pressure in a healthy range. And then that is another issue in itself, time. Where to exercise. Some communities, it's just not easy to go outside and take a walk. There's and sometimes motivation. I've had a rough day. I don't really necessarily want to exercise. Maybe I want to just sit and watch TV and eat something unhealthy. So there's a lot of factors adding to that as well. But heart disease has been for many years the #1 killer in many populations, especially African American community. So we really try to work on lowering blood pressure, and people that are at higher risk of heart disease or higher risk of heart attack or stroke, we do our best to see how can we improve those risk factors. Smoking is another issue. The cigarette smoke damages the blood vessels, and our heart system depends on the blood vessels. So getting out and talking about tobacco use, and especially going to the younger generation and kind of stopping them from starting smoking, would be a very helpful thing as well.
Yeah. You also mentioned HIV, which is interesting, right? Because I think it's the big disease of the 90s into the 2000s, and with everything else that's going on right now, it doesn't seem like really people are talking about HIV. It certainly hasn't gone away, right? And why? Right. And why is that? And I think it's important to bring up. So let's talk about HIV and how that. I know for a fact I actually worked in the HIV world for over 20 years, and so I know how disproportionately it has affected the Black, and African American communities here. But can you touch upon that? And even now, right? I think the importance of, hey, this is not something that was an issue 20 years ago, but continues to be an issue today.
Right. I mean, HIV is, yes, it's still around. The highest number of newly diagnosed HIV are generally African American women. It's sexually transmitted disease. Some people have thought, oh, well, it's not going to really kill too much people. And really, it's becoming more of a chronic disease, just as other, diseases are. So some people are still not really, in unprotected sex, or not always, thinking about, I really need to make sure I use a condom. A lot of people have thought, I've heard people tell me HIV is still a problem. I don't really hear about it that much. So there's a little bit of misinformation in the community, in some communities. And, it's easier to treat. We have better medications to treat it, but it's sexually transmitted diseases that's still one of the major type of illnesses that we see in primary care.
Yeah. No, it's definitely important. I think an interesting point is you spoke about maternal health. So how is this very significant with respects to the Black and African American community?
Mm-hmm. So we're about 3 times more likely to die of pregnancy-related illnesses. One reason is just that there tend to be more chronic conditions. Again, going back to access to care, maybe has underlying hypertension, diabetes that never was really treated, and then that can complicate the pregnancy and cause maternal high blood pressure is a big issue, or preeclampsia, where mother has to deliver immediately if the blood pressure is too high, and they can die from that if it's not taken care of immediately. And also, I think there's also some implicit bias and maybe some structured racism in there as well. I've heard some Black women tell me, when they're in the delivery or labor and delivery, I don't feel like I'm being taken seriously. They don't think I'm really in that much pain. Or I've had some women come back and forth from labor and delivery, in pain, or especially in early pregnancy, hyperemesis, frequently vomiting, and people are not taking them seriously. And then there are conditions that are happening that are not being dealt with. I feel that, at least in history, Black women have been looked at as, not really pain is not taken as seriously as it is in other groups, just classically. And just in the past, oh, they can't be in that much pain, or they're drug seeking. That there's a lot of misconception that is leading to very severe complications. But it's just very troubling that in this country we still have a fairly high maternal death rate compared to other first world countries.
Yeah, no, it's definitely something that I know has opened my eyes, to a lot, to your point, right? Here we are, one of the probably top first world countries, right? And our mortality rates are really high, and especially for our marginalized communities.
Right.
And it's not that we don't have the care, right, or the ability or the technology to make sure that that doesn't happen, or decrease that number.
Right.
So to your point, what is the issue? And I think you did a great job by explaining, not only is it an access issue and stuff, but we're also dealing with structural racism, and how that can play a part, unfortunately, in the mistreatment or the misclassification, of people, and leading to that unfortunate incident.
Yes.
So let's talk also about the elephant in the room, which is COVID, right?
Yes.
Everybody's heard, we've been talking about that COVID, well, COVID is a big issue everywhere, right? But it is disproportionately affecting people of color, right?
Yes.
There's more people of color that are ending, up getting infected, and actually, in the hospitals, and unfortunately passing away. Yet, as someone who's worked out in the community, where we try to promote vaccines and stuff, we do get a good significant amount of people who are anti-vaccine.
Yes.
And particularly some conversations I've had with some people that are African American, Black, here in New Brunswick has been, well, the reason that I'm not going to do this is because I don't trust the government, right? And they bring up the historical aspects of how the healthcare system has not done a great job in the treatment, right? In fact, mistreatment of people within the African American community. And I am not disputing that. That happened, right? If we talk about Tuskegee and other unfortunate situations that have happened, but I would, I'm going to go out there, and then I'll ask your opinion. I would say that this is different, right? COVID is different than what's happened historically. And so I guess my question to you is, what would you say to that individual who kind of said, I'm not going to do this because I don't trust the government, I'm not going to get a vaccine?
Right. Well, one thing is COVID-19 is very real. It's very prevalent. I've had patients tell me this can't be real. It's a hoax. It's a government hoax. I've had more than one person say that to me. That is absolutely not true. This is a very severe illness that can, and some people may be mild and may not have many complications. And some people may be hospitalized and on a ventilator and die from it. And there's also long-term effects from COVID that some people have. So we've had patients where, oh, it's just a little mild. I just feel a little tired. My taste isn't really there all the way. And some of these symptoms last for weeks. So you don't know how your body's going to be affected from COVID. It's very important to protect yourself as much as you can. So the social distancing is very important, when, especially at all times now, because we know it's still in the community, but especially in those peaks like we had just had in the beginning of the year. It's very important to do that social distancing, but it can be hard in some situations. But what we've seen is the vaccine has been very effective. Most people that have been hospitalized and have died from COVID have been unvaccinated. There's a lot of data behind that. And the vaccine, it's just like any vaccine, it doesn't prevent you from getting the illness. No, there's no vaccine that does that. Vaccines help your body build up immunity to fight it if you're ever exposed to it. So it's very important, if we have a tool to help fight this illness, it's important to use it. And I understand the hesitancy and the concern about the government, and how I've heard a lot. How did this vaccine come so quickly? I mean, it can't be real. If the truth is, the mRNA vaccines have been studied for many years, since the 1990s. So this is not new technology. It is just now we're being able to apply it. So, and it's been proven to be very effective and helps your body learn, COVID-19 and knowing that it's something it has to fight right away. And this is why it's effective. So there's a lot of misinformation, a lot of people listening to friends, family that may not be medical professionals, or reading things on Google or hearing this on TV or whatever the case, but it's important to really speak with a health professional if possible about your concerns. And we can go over and see, is this a valid concern? And not that the concerns aren't valid, but is this something that really inhibits you from getting the vaccine or not?
Yeah, I think you hit it right on, the nail on the head, if you will. This is not the type of situation that you want to talk to your cousin or your neighbor about, at least in terms of getting advice, right? You really want to make sure you're going to a medical professional so that they can apply what they know in terms of the facts, right?
Yes.
I always say if after you're given all the facts and you decide that the vaccine's not for you, there's not much I can say, but at least I am comforted with the fact that you're making these decisions based on the facts. And unfortunately, there is a lot of mis and disinformation on COVID out there, and so it's a never-ending battle, unfortunately. But
That's right.
Yeah.
Right. Yeah. So making an informed decision is important. Right.
So let's kind of pack it all back in together, right? So we've kind of discussed a few of the prevalent health disparities issues affecting the African and Black, African American and Black communities here in the United States. What could be done, right? On how can we help this, on a personal level, on a systematic level? I know we've already sort of alluded to, making sure that access is available, right? We've talked a lot about that. You've also alluded to, the importance of education, right? But what else, or what would you expand on in terms of what we can do in order to, confront these issues?
Right. Well, one is just increasing the health literacy. So getting information out there that people know that are coming from a reliable source or a knowledgeable source on that matter. I think just, being armed with information is a very useful tool. So commercials, there's been a lot of commercials for COVID, and, for instance, there are many ads. That's one thing that can be helped. Education wise, education is another issue. It's been shown that people with higher education tend to live longer, healthier lives. So, getting to in schools, maybe doing enrichment programs or after school programs, we're focusing on, wellness or physical activity, things of that nature would be helpful. And of course, just access to insurance, expansion of the Affordable Care Act. I mean, that's of course a process, but we see very clearly people that don't have insurance tend to be at a disadvantage because they don't have a primary care doctor usually. Some do, but a lot don't. So they're not being told or discussing what screenings should be done. So cancer screenings is another big thing that we do. A lot of people are not aware that you should be getting mammograms, that you should be getting colonoscopies, pap smears. Some people just are not aware of these things. And I think also just having, for us medical professionals, just have a better understanding of the issues that others have. I think we're not really taught that. I remember having one lecture in medical school about cultural competency, but we're not, some people just don't know. They haven't been exposed. They don't realize, well, why can't they just take their medication and come see us? It's a lot deeper than that. And, I think having us understand that better and see how can we work with people, how can we improve conditions is a big thing as well.
Yeah, that's great. I also worked at the medical school here for some time, and and it's to a certain extent not people's fault, right? Because people are going to come in with their reality, right? But what I like to tell people all the time is your reality is not necessarily everybody else's reality, and what you think is something that universally is accepted or universally provided isn't necessarily the case for someone else, right? To your point, why don't they take their medications? Well, easy for someone who has insurance that can get medications, that has the time, but if you can't, it's not that easy, or even making medical appointments, right? If you can't take off of work, it's not that this individual is not trying to make a medical appointment. It's more so that they can't make the medical appointment, right? And I think I agree with you that if we can get more healthcare providers to understand that there might be other mitigating factors as to non-compliance, then we can look for the actual problem and then look for suitable solutions.
That's right.
And lastly, because I think it's important, right? I mean, I don't think that we can take away the responsibility of each of us, right?
Yes.
To better or make sure that we have good health. So what would be, examples that, that you would provide right now to our community members in terms of how they can make sure, or, that they're staying healthy or to improve them health, right? Like, so let's say people, look, I know I can definitely shed a few pounds. So I love to hear, for someone where it's not that easy, right? Some people obviously can lose the weight or change a lifestyle relatively quick, but for the majority of us, it's hard. It's not easy. And so what would be advice that you can give in that sense?
Right. So yeah, as far as one for physical activity, sometimes we have to be a little inventive and creative. We don't necessarily, I hear a lot, oh, I don't have access to a gym. That's not the only way. Or I can't walk outside my neighborhood. It's not the only way. So try little things you can do, even if it's, something small, like using the stairs more often or walking further from, than you usually do when you're, taking a lunch break or something to that degree. As far as foods, trying to, as much as you can, if you're able to choose healthier options, if you can, that's always great. If you even canned and frozen vegetables, generally more affordable, those are still good options. It's better than eating carbs all day. So there's little things that we can do. And also if you have insurance and you have access to medical providers, it's important to go and see them and do your annual physicals and do the screenings that are recommended and ask questions, be your own advocate as well. Sometimes, I think I need this screening. What do you think? It's important to do that. And it's also important for people to use the community resources, especially if there's community health events. I always encourage patients, go to them. You're going to learn a lot. You may even get some free screenings done or some other information. And then of course, using any community resources, realizing people are here to help you. So yes, sometimes we have to do a little bit of work on our own to find, what is good for us and to improve our own health. So yeah, sometimes you have to be a little proactive and use whoever you have and whatever resources you have around you.
Yep, great. I think that's a great point to end on. And so, Dr. Toliver, thank you so much for your time. I think this was a great conversation. A lot. I know that I would want to think and continue to think about it. And I think the importance of continuing to have these conversations, right? So that people understand that this is not going away and that we can't just simply put it to the side. It's something that we need to address, both, as a community, as a group, as a nation, and as an individual, as we ended up talking about.
Yes. Thank you very much.
Thank you very much.
Yes.
Have a good night, everybody. Thank you.